Jennifer Capasso is a 42-year-old transgender woman, and she figured there was a good chance she'd be dead within 18 months. She'd been diagnosed with metastatic cancer, and her life had become a succession of treatments and surgeries as more tumors were found on her liver, her lungs, her large intestine, and again on her lungs. While she fought to survive, her care team was much more interested in what was between her legs, and some went out of their way to make her life, a stage 4 cancer patient's life, even harder because of that. Welcome to Factual, the live show where we explore issues of importance to the intersex and transgender communities through a lens that isn't being shown by the legacy cis media. If you're new here, welcome. My name is Ember, and I'm an intersex transgender woman. And today we're going to be looking at Jennifer's lawsuit against the hospital that both saved her life and tormented her at the same time, and build on that to look at how simply being trans or gender nonconforming results in additional barriers and problems in accessing healthcare, even when that care has nothing at all to do with gender. I do these shows unpredictably when I have both the time and the energy. So if you'd like to be sure to catch future installments, make sure to subscribe and hit the bell for all notifications. You might also enjoy some of the other shows I do, such as the much more chill morning show every weekday at 11 a.m. Eastern. Lately, we've been exploring the histories of science and other secular accomplishments. With all that said, let's learn about Jennifer's story. We'll begin with the fact that the story only broke this month, despite the lawsuit being filed back in March. Why that could be, one wonders. Here's what her attorneys published along with the filing. Hold, please. I have many tabs open. Live broadcasting, folks. Wardensky PC and Korea and Pluth PLCC have filed a lawsuit against Memorial Sloan Kettering Center on behalf of Jennifer Capasso, at this time, 45-year-old transgender woman who has been a cancer patient at MSK for the past 5 years. In her complaint, filed in the New York Supreme Court for New York County, Ms. Capasso asserts that she has experienced ongoing discrimination for being transgender throughout her time as a patient at this leading cancer hospital. Ms. Capasso, a Queens resident, became a patient at MSK after she was diagnosed with stage 4 metastatic rectal cancer in 2020. During her 5 years as a patient, MSK providers and staff repeatedly referred to Ms. Capasso as a man, including addressing her and referring to her as he, him, sir, Mr., and so on. They subjected her to offensive and degrading comments about being transgender, including during invasive medical procedures, and provided her with inferior care. For the first 2 years of her treatments, Ms. Capasso's patient records at MSK accurately reflected her female sex. In early 2022, the hospital unilaterally changed Ms. Capasso's sex designation to male without her knowledge or consent and refused to correct her records for nearly 3 years. Ms. Capasso chose MSK because of its reputation as one of the best cancer hospitals in the country. She wanted the best chance of receiving world-class medical treatment and surviving that cancer. Although MSK holds itself out as a welcoming environment for transgender cancer patients, Ms. Capasso's experienced hostility throughout her time as a patient there. The lawsuit asserts that in one egregious incident in March 2022, while Ms. Capasso was in surgery to remove a malignant tumor from her lung, her surgical team engaged in a lengthy discussion of her transgender status. While she was under anesthesia, the operating room staff mocked her for having man parts, described her and her former partner, who is also a transgender woman, as both men, and commented that being transgender was not right and doesn't make sense. During the surgery, The complaint asserts that one of the operating room nurses called a hospital administrator and demanded that Ms. Capasco's sex designation in her patient records be changed from female to male. During the surgery. Needless to say, this is not what people should be focusing on during the surgery. My goodness. In apparent response to this demand, Ms. Capasco's patient records were changed incorrectly and identify her sex as male. And over the ensuing 3 years, MSK refused to correct Ms. Capusso's records, subjecting her to ongoing misgendering and other discriminatory treatment by hospital personnel during her ongoing cancer treatments. And that's a big deal, because while what's between her legs doesn't make any difference to how she should be treated, the fact that it was there, that someone else changed it for her without her consent, meant that everyone else, even people who might otherwise be neutral or supportive, would misgender her by default. It created an extra barrier. It created a situation where people who weren't against her just for existing were acting in ways that made it seem as though they were, because of the alteration to her record, which again did not matter for the purposes of her care. It's indescribably cruel for a person going through such an incredible amount of suffering from the cancer. Quote, "The discrimination I've experienced at MSK has affected me deeply and made me feel unsafe and unwelcome in a hospital I am depending on to save my life," said Ms. Capasso. "I don't want any other trans person to go through what I went through. I want to do everything I can to ensure other trans people have the best chance of surviving cancer without fear of facing hostility or disrespect." And this is an important note, because more and more frequently we've been hearing all across the media about trans people who are reluctant to seek medical care for things that have nothing to do with being trans. There's a phenomenon called trans broken arm, which is based on a hypothetical or perhaps someone's actual anecdote, whatever the case may be, of a person who goes into emergency room with a broken arm. And they get seen, they get, the provider comes in and examines them, takes their blood pressure, and instead of addressing the broken arm, spends the entire time they're there grilling them about being trans. It's unreal how much of a distraction it is to medical care providers. And you'll run into situations where a person will have vertigo and can't get the provider to talk about the vertigo because they insist on focusing on the hormones and what does it do and how do you get that and who prescribed it and what processes and what psychiatrist did you talk to. And can we talk about the vertigo or the broken arm or whatever the issue is? So not only is it an additional barrier to access care, but because of the hyper focus on this sort of stuff, this inappropriate conduct, to say the least, people don't want to go to get their injuries treated. They'll just improvise something at home. It's pushing people not only out of public life, like so many hateful bigots have called for, but it's putting people into danger. It's very similar to the situation we had several years ago where homosexual people who were visibly homosexual would go out of their way to not use a public restroom because of the harassment they would face. And as a consequence, there were accidents, there were problems, there were kidney infections, kidney stones, bladder infections, urinary tract infections. These are never great, but compared to not being able to get you're cancer treated. That seems kind of minor, but this is a thing that happens in our society. This is a situation that people have to deal with. And while it may be understandable that the average run-of-the-mill person might have heard about a trans person or an intersex person on television, since we seem to be the talk of the town the last few years, they may have questions. But a professional in a professional setting should be able to, at the very least, keep their bigotry in their pants. One would hope. After all, we wouldn't tolerate this kind of behavior in reference to any other minority. We wouldn't stand for it if a doctor messed with an Islamic patient because of his religion. We wouldn't find it acceptable if a person discriminated based on the color of their skin and interrupted a surgery to have a call with the administrator saying, we shouldn't be treating this person because they have the wrong skin. A lung is a lung, Bethany. What are you doing? My goodness. So yeah, absolutely. It's important. And also remember, MSK is one of the most accepting facilities. And this is where we branch off a little bit into some real world experience. As some of you know, I wear a prosthetic. It doesn't fit for this reason, because when I received the prosthetic, what I needed to not die, I was supposed to wear it for a few weeks so that my body could adjust to it and then come back and have it, fitted properly, the final fitting kind of thing. The facility canceled the follow-up appointment and made it impossible to reschedule. There were no options. There was no possibility. Everything, the website, the email, the social media, for crying out loud, going in person, everything went back to, you have to call the phone number. And when you call the phone number, no one answers and you have to leave a message and then they just don't call you back. So I never was able to reschedule that follow-up appointment they canceled. And so I'm left with a prosthetic that doesn't fit. This isn't the only situation like that I've had. For instance, one of the reasons that I don't use headphones, I have to use a speaker and balance the input and output of the speaker with the microphone so we don't get a feedback loop on these shows, is because my ears are fucked up. I got really severe ear infections several months ago. Hell, it's been more than 7 months now. And nobody would treat me. A healthcare provider would walk into the room and say, what seems to be the problem? And I'd describe the symptoms of inner ear infection. And they'd say, are you on any medications? And because I was under the impression that you should share that sort of thing with your doctor, I told them. And from that, they knew. And so immediately after, they'd look at my ear and say, oh, it looks like it's just dandruff in my ear. Or, oh, it's a sinus infection on the outer surface of my ear. And I tried this, 5 or 6 times. I went to different providers and I kept getting bullshit, we're not going to answer you answers. Until at a certain point, you get the message. Your kind just isn't welcome here. They won't say it outright. They'll just make things difficult for you. They make it impossible to access healthcare. And they do it in a way that makes it clear why without actually saying so, because then they'd be liable for some issues, They wait until you have said what medicines you're on, and then immediately in direct response to that, give you a runaround, give you a bullshit answer, tell you to get the hell out. Your kind isn't welcome here. Whatever your feelings about minority people of any kind, I would hope that most people would agree that professionals should still act with professionalism. Obviously, my point of view is that bigotry is a sign of ignorance, and ignorance should be corrected. That there's no reason to hate people because of who they are. That makes you a bad person. But I would hope everyone would agree that in a professional setting, even if you are a bigot, you should set that aside and do your damn job. One would hope. Now, this story is important because MSK is one of the most accepting facilities, including the way they handled, the way they treated Miss Capasso. If they're one of the most accepting, we can only imagine what it's like at the ones that aren't accepting. Well, sadly, we don't have to imagine. Find a trans person. Any of us. Any of us. And we can tell you. Because we've all been through it. The lawsuit asserts that MSK's conduct violates the prohibition on discrimination based on gender identity in healthcare settings under New York State and New York City human rights laws. Now, that's a point worth noting because this took place in New York City, which of course is in New York State. That means it's covered under the state's human rights laws because the federal human rights laws are somewhat unreliable. Half of them are policies rather than legislation, and the other half seems to be judicial decrees that can be overturned at any time based on the political winds. So, not exactly steady ground there. But since this is in New York, then it falls under New York state law, and we don't have to worry about the federal nonsense. The downside is the way New York State processes civil rights claims is if they're of a certain size or they involve businesses, agencies, entities above a certain size, then they get sent to the federal anyway. So that's a problem. But New York State, as far as I can tell anyway, is slowly ticking along with these issues. New York City's LGBTQ healthcare Bill of Rights guarantees transgender patients the right to have their gender identity recognized, affirmed, and documented, including through staff members using a patient's self-designated name and pronouns. Now, to be clear, Jennifer's legal name is Jennifer. But even if it weren't, under this law, the facility would be required to address her that way. There's also another very little known law in New York State about name changes where it predates Social Security cards, and so the identity requirements are a little bit tricky for it. TLDR, you can change your name through usage in New York. If you make it known and you make it clear that your name is no longer this and is now this, that's a legal way to do it in New York. It's just really hard to pull off with today's documentation requirements. Pesky gravity. The law also requires that there's an insurance to access to paper and electronic records that accurately reflect the patient's self-designated name, pronouns, and gender marker. So under New York law, Ms. Capasso has the right to be treated as a woman by MSK and her other healthcare providers, which once again, considering she was being treated for cancer, should not actually matter to the providers. Joseph Wardensky, principal of Wardensky PC, one of the attorneys, said MSK's years-long refusal to ensure that its providers and staff treat Ms. Capasso with dignity and respect is unacceptable. We applaud Ms. Capasso for stepping up to seek justice for herself and for other transgender patients at MSK. And perhaps more importantly, bringing a case based on this to light, because it is very, very hard to do. Again, MSK is one of the best when it comes to how they treat transgender patients. So we need this in court law. We need this in front of the state departments that adjudicate these sorts of things so that they can make it plain to other facilities they will be held accountable for this kind of crap. It can't be allowed. It's literally a threat to public health. It can't be permitted in any way, shape, or form. But how do you prove it? And that's the rub, because all too often, what can you do? Say a person called me by the wrong pronouns. Oh no, how terrible. But if everyone calls you by the wrong pronouns, because that's what's in your medical file, because they refuse to update your medical file, that's a bit of an issue. But also, how does one prove that the file was maliciously updated during a procedure, a surgery that ostensibly Jennifer would have not been conscious for? How can there even be witness testimony of such a thing? Well, I'm so glad you asked, because like I mentioned at the start, this story actually broke this month, and there's been a little bit of coverage on the matter. So now I'm going to read a little bit from the New York Times article, and I do want to say it's lovely that the New York Times is finally starting to cover transgender issues from a non-nationalist perspective. It's a bit late, but better than never, I guess. So this is from the Times. At her apartment in Long Island City, Queens, she read cancer research papers and estimated her chances of survival, updating the odds after each scan, each tumor, each treatment. She tried to remember exactly what her doctors had said and the tone they had used. It frustrated her that she was unconscious at the most crucial moments as the surgeon removed each cancerous mass. What if the surgeon said something important, a stray comment that no one bothered to tell her about after the anesthesia wore off? She decided to record her next surgery on March 7th, 2022, at Memorial Sloan Kettering Cancer Center, the renowned Manhattan hospital. Quote, "I wanted to know what's going on," she recounted. She turned on the audio recorder on her phone before the anesthesia hit. Knowledge is power. The surgeon that day removed a part of her lung. She did not get around to playing the recording until a few weeks later. Though the audio was muffled, she could follow some of what the surgical team was saying before the procedure began. Someone was going out for coffee. Did anyone want something from Starbucks? And then the conversation shifted. Rather than talk about the surgery, they were commenting about her gender. Quote, "It still has man parts." It seemed to Miss Capasso that they were talking about her genitals. On the recording, the healthcare workers express a variety of opinions about transgender identity more generally. Quote, "Not that it's not right, but I don't get any of it." Another, in the middle of the conversation, one person suggests updating Miss Capasso's medical file. "Yeah, it needs to say male," the person says. Miss Capasso said it appeared that the hospital staff had, in fact, changed her electronic medical records while she was unconscious for that surgery. With her records now marked M for male, some hospital staff members called her Sir during her weekly appointments, such as blood draws, thinking they were being respectful. Others made a big deal about her being transgender, because having male on your record and looking like a woman could make one think you're transgender, perhaps. Now, I do want to say people should not assume on that count. There are a lot of gender nonconforming people, and everyone you encounter in your daily life that you think you can clock is probably cis. There really are not that many of us around. There are a lot of people who don't meet typical beauty standards, though. And maybe don't be a dick to people who are already likely insecure about their looks. But also, there's intersex people. There's as many of us as there are trans people. In fact, there's quite a bit of overlap between our two groups, but not everyone who's intersex is trans, and not everyone who's trans is necessarily intersex. So don't go making assumptions on that count either. But if you start referring to an intersex person as trans and they're not, you're going to hear about it. One person, perhaps taunting her, perhaps trying to be supportive, said things like, "Yes, queen," which she said were also unwelcome because she wasn't there for gender affirmation. She wasn't there for comments about her presentation. She was there for fucking cancer treatment. Ms. Capasso said that when she asked hospital administrators to switch the male designation back to female, she received a surprising answer that it couldn't be done. They did it in minutes, but they couldn't change it back. She recounted the interaction in the court papers, part of a lawsuit she filed in March in the state Supreme Court in Manhattan, accusing the hospital of discrimination. Ms. Capasso's lawyers shared the surgery recording with the New York Times. The hospital, in its own court filings, has denied discriminating against Ms. Capasso and suggested that her secret recording invaded the privacy of its healthcare workers. Imagine that. The hospital denies changing Ms. Capasso's sex designation in medical records, despite the fact that it was changed in the records. How do you deny something that you can just show people? But they did. And denies that the plaintiff has been misgendered and misidentified in all of her records since 2022, which again, they are records. You can look at them. They can be seen. They can be read. What do you mean? In response to questions from the Times about Ms. Capasso's lawsuit, Sloan Memorial Kettering said in a statement that it, quote, does not comment on ongoing litigation, which in fairness is actually standard protocol. Most lawyers will tell you if you're being sued, just don't comment on things and just tell them it's because of the litigation. Ms. Capasso said that long before she made the recording, she'd experienced discriminatory treatment at the hospital. Yes, thank you, Ray did, Seth. It reminding us of the age-old adage, never assume me, or you make an ass of you, and me ass you me. That sounds like a Pokemon when you say it that way. My goodness. Thank you all so much for joining. I appreciate you being here. Shows like this get a lot of hate, so they're often restricted to subscriber only for the chat. But also there have been several incidents over the course of the last week, so we're a bit more locked down than usual. I appreciate y'all being here. If you find you cannot comment, consider hitting the subscribe button. It'll only take a few minutes before it kicks in. Let's see. Ms. Capasso said that long before she made the recording, she'd experienced discriminatory treatment at the hospital. The year before, during an endoscope exam of her colon, the surgeon kept referring to Ms. Capasso as he when mentioning her to other medical workers, Ms. Capasso said in an interview. That's a thing a lot of trans people encounter as well. For instance, after a certain incident at my job last year that involved a whole lot of blood coming out of my body in unexpected ways, I found myself having to go through medical imaging, x-rays, MRIs, and so forth. And the imaging technicians kept referring to me incorrectly. I understand that they didn't actually care because their whole thing was taking the images and whatnot. They were a little bit confused given the fact that I have rather atypical anatomy in the abdominal region, shall we say. But whatever. You know, it's suboptimal to refer to people in a way that will cause stress and duress while they're already in a very difficult and often painful situation. Causing additional stress does not help with healing, but at the same time, it's easy to give people like that some grace because they don't care who you are. They're just trying to image what the problem is. But even so, the fact that it comes up, the fact that it happens because there may be an error on your record, it's making things harder for you. And it doesn't need to be there. You know? Jennifer said it was among the worst interactions she had experienced as a trans woman in years, resurrecting old anxieties. And that's another good point, because a lot of us have finally worked through the nonsense about passing or being clocked or whatever. And then you're thrown right back into it by people who are aggressively misgendering you. And that's more than just rude. There's often a lot of trauma associated with that sort of thing. After all, there's a reason we're trans people. So Miss Capasso began her transition in 2015 in her mid-30s. She formed a tight circle of friends and was dating. Life made more sense to her. And then in 2019, she was diagnosed with cancer. Over the years that followed, Miss Capasso was on 2 medical journeys. One at Memorial Sloan Kettering to keep death at bay, try not to die being one of my own mottos, and one that's not exactly going well recently. Such predicaments we must forge ahead. The other, with the help of other surgeons, to fix her body. Starting in 2021, she underwent half a dozen procedures to feminize her face so that she would stop getting misgendered all the damn time. Her brow ridge was sanded down. Her orbital bone was shaved to give her eyebrows an upward tilt. Her square chin was softened. There were cheek implants. Changes to her nose, too. Some people may be wondering why the hell a person who's dealing with stage 4 cancer and probably isn't going to live another 2 years would bother with the expense, with the difficulty, with the pain of a surgery, and then the additional difficulty and pain of recovery. Another rough bit about these shows is I have to do a lot of talking without break. It dries out the throat. And if you find you're experiencing dry throat, oh, where's my thing? Where's my thing? I have it around here somewhere. I've too many. Okay. This'll do. Head on over to epicwaterfilters.com, enter code EMBER15 at checkout for 15% off any filter, water bottle, etc. Guaranteed to help with your dry throat, at the very least. My goodness. That's my morning show partner, but sometimes it's amusing to throw it in to lighten the mood, which is why I don't have a vertical format for that one. Anyhow. Yeah, thank you, right-handed Sith. Sith says, nice segue. Yeah. Well played, Ember. Well played. But it's another thing that people need to understand. While dysphoria varies from person to person, the amount of stress and suffering that comes along with being seen incorrectly can and often is so severe that a person would literally prefer to die trying to fix it than not. And I must confess, these are thoughts I've had myself when I first started my transition. And again, things are weird for me because my anatomy is atypical. But when I first started my transition, I was warned by a lot of physicians that there were risks, of course. You know, certain medicines carry risks of blood clots or various other complications. And my instinctive response was, it doesn't matter. If I die more myself. It really sucks to look at it that way, but it's true, because before I started, I was at the end of my road. That was as far as I was going. And the fact I had to go that far is kind of bullshit. People shouldn't have to suffer and suffer and suffer and suffer until they do not want to live before they're allowed to finally start getting help for that suffering. You know? But I digress. Quote, I needed radical surgical intervention, Jennifer said. And she needed it fast because the clock was ticking and maybe not for much longer. Quote, I wasn't going to die looking the way I looked. especially getting treated the way I was getting treated, she said. Like, not a chance. What is that saying? Leave behind a beautiful corpse? She had decided on an open casket funeral. Because again, stage 4 cancer, less than 18 months to live. I was going to be a pretty corpse, she said. Even while preparing for death, she found that the feminization procedures gave her more confidence. Quote, I wanted to blend in and be able to go out in public and just kind of be ignored, she said. And that's an important thing, too, that a lot of transphobes don't seem to get. We're not trying to make ourselves beauty queens, although some of us are, because trans people can be beauty queens. We can be beautiful. Or on the other end of things, we can be masculine. We could be Mr. Universe, whatever. But we're not out there to be like total knockouts. We're trying to blend in. We're trying to be nondescript for the most part, which is really weird when you think about it. Although, not unheard of. There are some people who achieve celebrity at a young age, say, for their beauty, and then go out of their way to be less beautiful so that they get chased less, which is handy. Say lovey. So Miss Capasso believed her transition and her life living now as a woman is what kept her alive. And that's true for a lot of trans people too. But her newfound confidence was fragile. Whenever she went to Memorial Sloan Kettering, she felt dread, and not only the mortal kind. Quote, I was constantly being reminded every time I went that I'm different, she said. It immediately brought me back to earlier days when I was very visibly trans, and it was rough. It is unusual for patients to record their own surgeries or for such a recording to become key evidence in a lawsuit, but it is not unheard of. One man who recorded audio while sedated during a 2013 colonoscopy in Virginia sued over the anesthesiologist's remarks. The doctor told another medical staff member that she found the patient so annoying she felt like punching him. She said a rash on the patient's genitals was probably penis Ebola. The patient, who was awarded $500,000 by a jury, said he had hit record on his phone because he wanted documentation of what the doctor said. He was worried that the sedation would leave him too groggy to remember, which is all too often exactly the case. Ms. Capasso insists that she was not trying to catch medical staff speaking disrespectfully about her. Indeed, as we can determine from the facts of the records and the case and the procedure of things, all the evidence there is, all the receipts we have, she didn't even suspect there was a problem until she heard that first recording. And instead of, what if the surgeon says something that doesn't get repeated to me in recovery, they were talking about completely inappropriate matters. They were talking about her fucking genitals when they were doing a lung surgery. What the hell? And then fucked with her record in the middle of a surgery. That's unacceptable for anyone under any circumstances, regardless of which minority you might belong to. She said she was motivated by a curiosity and a desire to know exactly what the surgeons discovered. It may not be such an unusual impulse. Early in the recording, healthcare workers can be heard preparing for the procedure. The doctor, who is named in the story, but I won't name here, who is a surgeon at Vanderbilt University, led a medical conference in 2021 on surgical recordings. He said there is often a really strong desire by patients to know what happened to them in the operating room, Dr. Langerman said. And I think a valid right to know what happened. Surgery was once a relatively public event. You may recall operating rooms were once called theaters, and that was for a reason. Medical students would often watch procedures so they could learn, but infection control and malpractice insurance requirements pulled the operating room out of public view. Quote, operating rooms and surgery have become one of the most secretive environments in modern society. And that was another doctor from Stanford University, a professor who started a company that uses operating room recordings to improve patient safety and hospital efficiency. On the day of the March 2022 surgery, Ms. Capasso put her clothes, purse, and keys in a bag that the hospital gave her for her stuff. She turned on her phone's recording app and placed her phone in the bag too. The bag, she hoped, would follow her into surgery. She remembered laying there, worried the anesthesia wasn't working, and then she was gone. In its response to the lawsuit, Memorial Sloan Kettering suggested that Ms. Capasso's actions raised privacy concerns. Despite the fact that they said they won't comment on ongoing litigation, they commented on the ongoing litigation, which shows they don't actually mean it when they say that. But never mind that. That's a separate issue, you silly. We're not talking about that today. Quote, the secret recording captured portions of a discussion that occurred during surgery while plaintiff was under anesthesia, in which the staff members discussed plaintiff's transgender status with every reasonable expectation that plaintiff would not hear the discussion. Lawyers for the hospital wrote in the court papers. The court papers say little about the substance of the remarks, beyond stating that the hospital denies the surgical team mocked Ms. Capasso. Again, there's a recording, bestie. People can check for themselves. Quote, plaintiff's clandestine recording is largely inaudible, such that it is impossible to ascertain the speakers or the full context of their discussion, the hospital's lawyers wrote. On the recording, which was shared with the Times, it appears that the medical workers are discussing their feelings about transgender identity. It is difficult to discern how many people are talking, but the remarks are clear. Quote, not that it's not right. Quote, it's not. Quote, it doesn't make sense. I don't get any of it. I'm sorry. Then one of the workers suggested that they simply don't know enough. That's the thing, the voice says. Quote, it's hard to understand because you don't see it every day. You're not living it. At various points during the conversation, there are repeated mentions of something that happened earlier when Ms. Capasso arrived. She had been asked to take a pregnancy test, which is a routine preoperative step for female patients. Even though she doesn't have a uterus, she had offered to do whatever was easiest. Quote, I don't want to go into the operating room with any bad vibe, she later explained. In the recording, the healthcare workers can be heard reassessing how Ms. Capasso's medical records describe her. Quote, it's not supposed to just say female. One can be heard saying, it's supposed to say transgender female. The healthcare workers debate what gender and sex information they should input for transgender patients. They say the hospital's policy is unclear. Quote, it's still wrong per se, someone says. Then the conversation takes an unexpected turn. One healthcare worker announces that she will contact an administrator who works on improving care for LGBTQ patients. Quote, she's like in charge of this trans stuff, the worker says. Phenomenal. Why, pray tell, did they not do that before? Like, immediately. A phone call ensues. Again, during the surgery. After explaining the situation, quote, they're ordering pregnancy tests on the patient too. The medical worker explains that she had updated Ms. Capasso's medical records and wonders if that was the correct thing to do. She made the change and then wondered if she should have done it. Amazing. So then we just have to change it back to female, the worker asks. I was just trying to make things right. But then the worker seems to reconsider. After the surgery, it was there. Every time Ms. Capasso logged into her online patient portal or looked at test results. M. Before, she had generally been listed as F for female on any form with a field for sex or gender. Ms. Capasso wondered who had made that change and why. It was around then that she listened to the recording. Her stomach dropped when she heard the discussion about changing her marked registration as male. Healthcare workers debated whether their patients' medical records should be listed as male or female. They didn't even consult the patient. According to her lawsuit, the M in her medical records changed her interactions with hospital staff, as one might expect. At imaging appointments and blood draws, consultations, staff members looked at her longer than they had before, struck by a dissonance. Quote, "My name is Jennifer, and I look the way I look, and I sound the way I sound, but it says M on there," she recalled. You could see there was a reaction. She just wanted cancer care. She wasn't even there for gender care. Quote, "I don't want them concentrating on my transgender status," she said. "I'm going there for them to keep me alive and hopefully cure me." In legal filings, Memorial Sloan Kettering states that its records accurately reflect plaintiff's sex assigned at birth as male. It should be noted that under New York law, that's irrelevant. It's, first of all, under the human rights law that we talked about earlier, it matters how the person identifies. The point is to identify the person. Why in the world, for example, if someone issued a driver's license for someone who looked like Dolly Parton and put an M on the driver's license, does it paint an accurate picture of who you're looking at? You know, it's not useful. It's just cruel, and it's counterproductive to the actual point of identification. But also, there's a number of regulations and factors that go into effect here. Sex at birth is almost useless in the case of a transgender person, because unless it's dealing with something specific to the original anatomy, if it's still there, it has nothing to do with anything. In Jennifer's case, hormonally, she's female. In almost all of her anatomy, she's female. Psychologically, she's female. Her blood is female. Her muscles are female. And what do you mean it's accurate to put male on there? Unless you're checking her for cancer in those parts, not relevant. However, quote, "Such information is relevant to and necessary for the provision of standard of care treatment," the hospital staff said in court papers. "I would love for them to explain how." More importantly, how is it more relevant than a person's current physiological status? How is it more relevant to know what a person had between their legs at birth than how their body works the day you're working on them? Medical journals and research articles have emphasized that doctors should be fully aware of the anatomy of their transgender patients. And that's true, because transgender people come in a variety of states of transition or desires to transition. There's a lot of people who don't do anything medically. They're valid as trans people, but the doctor needs to know that they have their manufacturer parts. And there are other people who go all the way through transition, and the doctor needs to know that they've got aftermarket parts and no longer has the original parts. Kind of important. And there's everything in between. They say they need the information, specifically the sex assigned at birth, in order to screen for diseases such as cancer and to properly interpret lab results. And that's one of the big issues, because lab results change depending on your sex, but it's pertaining to your hormonal sex, not your chromosomal sex, not your anatomical sex. What's in your blood varies in accordance with the other things in your blood, not what's in a completely unrelated body part. If you've been on HRT for a year or 2 or 3, you are hormonally the sex you're taking the hormones for. And that is how to properly interpret the lab results. if someone were to, for example, take my blood and try to measure me against a cis woman, I'd get mostly normal readings. If they tried to measure me against a cis male, they'd get extremely anomalous readings and probably hospitalize me immediately. So it's kind of important to know, you know? Transgender women, for example, are less likely than men to be screened for prostate cancer, although they can remain at risk, some studies suggest. Now, a note on that, it is technically true. However, the risk rate for prostate cancer in trans women who retain their prostate drops so very, very low. That's not to say don't take it seriously and don't get screened, but it's really low. But also, and this is a thing about public ignorance as well as information not being spread properly through medical care, because in a lot of cases you end up having to educate your physician about stuff. A thing that I just learned the other day is 100% of trans men develop prostate tissue. Trans men on HRT, I should specify, people who are taking hormones, testosterone specifically, androgens, develop prostate tissue. That needs to be monitored. You need to keep an eye on that because it can develop into prostate cancer, the same as in a cis man. And nobody knows because we're also hyper-focused on trans women for culture war issues. Incidentally, the study that shows that 100% of trans men on HRT do develop prostate tissue is linked on the website betterthanember.com, along with all the other science I reference so very often. That's why that website is there. FYI. It's right down here, betterthanember.com. There's a bunch of cool stuff on there. You should check it out. When Miss Capasso asked Memorial Sloan Kettering to change her designation back to female, she was told it would take 2 or 3 years. Administrators said they needed to wait for new record-keeping software, so they changed it in minutes, but it would take years to change it back. Amazing. The hospital alludes to this exchange in legal papers, which describe how staff members sought to, quote, explain the limitations of its previous electronic medical record systems in respect of the way in which sex and gender identity was reflected, which is a legalese way to say the system couldn't do it. It could change it in minutes, but it couldn't change a 1-bit piece of data back. It had no Control Z. It couldn't undo. So sorry. Ms. Capasso, who had worked as a software engineer for an artificial intelligence company, knew they were full of shit, to put it colloquially, shall we say. It had taken no time for healthcare workers to relabel her male while she was anesthetized. Quote, but now I'm asking for it. It's going to be a couple of years, she said. That was longer than she expected to live. It felt cruel, she said, like they were trying to wait me out. Now, once again, Jennifer's story is one of many. Most trans people have similar stories. Most gender nonconforming people have instances where they at least had to clarify for their healthcare provider what the hell was going on. And intersex people, that's a whole other thing. And when you're multiples of these things, you can imagine how much fun we have. But I wanted to shine a light on this story because it finally made national news. It finally got the attention in the Times, and it demonstrates a very egregious instance of something that happens to so many of us everywhere. Because it's such a high-profile hospital, because the evidence for it is so ironclad and so obvious, and because the treatment has nothing to do with what she was there to be treated for. I hope it makes you think about some things. I hope it's made you aware of some things. Before we go, I have seen a couple of questions pop up. I'm going to scroll back a bit and try to get to a few of those. Let's see. Right-handed Sith says, and yet a cis woman can go get a chest augmentation without question or hesitation. Often there's some questions, yes, but it is worth noting there's also a problem with physicians listening to women describing problems and not hearing, not understanding, or just saying, maybe you need to lose 20 pounds. You know, I mean, for instance, and this is a big issue for trans women, because if you pass, you get not listened to. If you don't pass, then you get treated weird because you're a trans person. Damned if you do, damned if you don't. But in any case, I had occasion to, I'll be blunt, there's no point pussyfooting around it. I was exhibiting signs of an eating disorder. A number of friends became concerned and urged me to contact a psychologist. I did. The psychologist reviewed my information and confirmed I did have most signs of an eating disorder. The only one that was missing was the fact I was severely overweight. So the suggested treatment for this eating disorder that this person offered me in this consultation was to try losing weight. Amazing. Right-handed Sith says, you are a beauty queen. I mean, I do have my crown. So, I mean, I can. My goodness. Oh, goodness. Aunt Jer says some teen cis girls get augmentation or reduction. Yes. And in fact, my kids went to high school with girls who got reductions because too much can be painful. It can hurt your life. It can make it hard. You know, back pain, no fun. It's an ish. And that's absolutely valid. Right-handed Sith says, I think they misunderstood the title of the oath they took. It's Hippocratic, not hypocritic. Yeah. Hypatia says, can you legally change your sex marker on ID in the US? It varies from state to state. In states that have either identity protection laws or human rights laws, or there's various laws. Some states have, it's different for every state, but there's something like a dozen states where the ability to get identity markers with the correct marker on them issued are guaranteed at the state level. Sometimes it's just a law. Here in New York, it's a constitution level amendment. But in other states, it's not available, or it's not protected, or in some states, it's specifically not allowed, no matter what, much to their detriment. So it's a mess. It's a mess down here. Let's see. Karen Butcher says a solid medical history should help you decide what screenings should be given. And that's true. I mean, as a general rule, I am not a physician. It's one of the areas of study that I never quite made it to, but that's not important. I would suggest to any trans person that not only should you make sure your healthcare provider is aware you're trans when it is relevant, but in cases where it may be relevant if you don't know. And if there's ever any doubt, you should definitely note that, owing to the fact that you are a trans person, or in some cases, if you're an intersex person, if like me, you have elements of both sexes within your anatomy, you should make it plain that you need tests and procedures relevant to both standard body configurations. It's worth noting. And it could potentially save your life. Okay, I think that might be all the basics. All right. Yeah, the United States is 50.2 countries in a trench coat. Absolutely. Alrighty, folks, that's going to do it for this time. there's a lot going on today. So thank you so much for joining. And we've got a lot more to cover. So stay tuned. Subscribe if you haven't, because we're going to be back probably pretty soon. There's a lot more in the pipeline, as you can imagine. But thank you for being here. Do remember to like. It helps with the algorithm. Do remember to share. Some people need this information and they're not going to see it any other way. And as always, remember, you don't have to talk shit about sleeping patients, because you can just be honest with them in the first place. You can communicate and you can learn and you can be a better goddamn person, or at least try to be a professional, because you are better than ignorance. Good night. Thanks to all our patrons and top-level members for November. Miranda, Karen Butcher, Jessica the Trans Metal Alchemist, Robin Webster, Maya Adkisson, Jimmy Tux, Ian Chen, Lilith, Ember Lynn, The Barely Bearable Atheist, Eric Wander, Jason Jacoby, Godless Engineer, Jester, Lil of All Trades, Deviant Outcast, Kelly King, the Detroit Atheist Queen, The Mighty Filbert, and Secular Phalanist. And you can add your name here next month by signing up at patreon.com/betterthanember, or by joining Emberships here on YouTube at the Cinder level, which also includes all the custom emojis, tons of member-exclusive content, member-only live streams, and a bunch of other stuff. I deeply appreciate all the supporters who keep this channel going. Thank you all so much. Because of you, we're building a wonderful community that I'm very proud of.
Just like a spark that's breaking out, can't make a stop.